Okay, so
Today's lecture is Adrenergic Antagonists, and uh, the adrenergic antagonists are sometimes called adrenoblockers, bind to the receptor and prevent the activation of the receptor. So this is the adrenergic antagonist. Um, and There are two types of the antagonist. So one is a direct acting at the adrenal receptors, and the second one is indirect antagonist that prevent the release of the neurotransmitter or deplete the neurotransmitter. And so direct antagonists work like this. Uh, as you can see on the slide, this is adrenergic uh, receptor. So this is adrenergic receptor. This is a neurotransmitter noradrenaline, and this is the antagonist. So, and neurotransmitter is released and goes to the adrenergic receptor, but antagonists will catch this receptor on the way to prevent it to because the receptor here is busy with the antagonist. That is why noradrenaline will not reach the receptor and activate the receptor. So this is the schematic representation of the mechanism of action for so you can easily remember the mechanism. And this is another example. Here also the receptor. This is adrenaline, and here we have two antagonists. So this is actually agonist, and these two antagonists they block the receptor, and that is why uh, there is no activation of the receptor. And all the adrenergic antagonists are divided uh, to uh, direct uh, direct adrenergic antagonists are divided to alpha adrenoreceptor antagonists or alpha blockers and beta blockers. Beta blockers block beta receptors, alpha blockers block alpha receptors. And exception is labetalol blocks both alpha, beta and alpha receptors, alpha 1 specifically. But it mostly blocks beta, all beta receptors plus alpha 1 receptor. And then there are indirect acting, so reserpine that uh, decreases reuptake and release of the uh, norepinephrine. And alpha adrenoblockers uh, uh, affect mostly the blood pressure because the blood pressure is controlled by the sympathetic nervous system, and the alpha 1 adrenoreceptors are located in the large vessels that contribute much to the uh, to the blood pressure. And then the blocking of the alpha adrenoreceptors will lead uh, to the decrease in the blood pressure and also decrease of the uh, peripheral vascular resistance, and that leads to the reflex tachycardia because of the decrease in the blood pressure. And the higher is the lower is blood pressure, the higher is tachycardia. And we have two non-selective alpha blockers, phentolamine and phenoxybenzamine. So these are non-selective alpha receptor blockers, and uh, they act uh, on the vascular resistance and reduce blood pressure and lead to the reflex tachycardia. And the action, they also block the effect of the uh, epinephrine. So epinephrine normally will increase the blood pressure, but with the if we give an alpha blocker, then epinephrine will decrease blood pressure because it will only stimulate beta 2 adrenoreceptors of the vessels, and the alpha receptors will be blocked. And with the norepinephrine, it will decrease the action of the norepinephrine because norepinephrine will not act on the beta receptors much, mostly alpha mimetic. So that is why the action of the norepinephrine will be reduced. Isoproterenol is a pure beta adrenomimetic, and that is why alpha blockers will not influence to the isoproterenol. So because it only stimulates the beta receptors, so it will not act on the alpha receptors. And phenoxybenzamine and can be used for the treatment of the chromocytoma, that is a tumor of the adrenal medulla, during which the adrenaline is released in the blood in large amounts, and usually phenoxybenzamine is injected before the surgery to prevent the high blood pressure, and sometimes it's also used for the treatment of Raynaud disease and also the frostbite. The adverse effects include orthostatic hypotension. Orthostatic hypotension means that the decrease in the blood pressure when switching the position of the body from sitting or lying to standing. So that is why when you stand up, try to stand up slowly, don't rush. Then reflex tachycardia, this is a heart actually, and then dizziness and headache and sexual dysfunction, because alpha receptors also contribute to the erection and also to the relaxation of the vessels, that increases the blood flow to the genitalia. So the ejaculation is also inhibited, and so in severe cases, vomiting can occur, and also nasal congestion can be seen in some patients. Then the next group of drugs are prasazine, doxazazine, and terazazine. So these are selective alpha-1 blockers, and they used as a antihypertensive drugs, and because they decrease the peripheral vascular resistance and decrease the blood pressure, by relaxation of the smooth muscles of the vessels, and but unlike the previous group, unlike the phenoxybenzamine and phentolamine, they don't lead to the reflex tachycardia, and that is why they're effective as antihypertensive drugs. And also, tamsulosin is a selective alpha 1 alpha 1 B subtype of the receptors. Tamsulosin is alpha 1A receptors, and is prescribed to treat the diseases of prostate and bladder in men. That is usually in the benign prostate and disease seen in some old men. And
Doctor,
yes,
one question, please, if you don't mind. Um, it's about the adrenergic um, drug. Um, the adrenergic blocking agents that we are discussing now, we see that uh, their side effect is sexual dysfunction, and you've mentioned that they inhibit ejaculation since it has to do with the sympathetic nervous system. The epinephrine is the dominant, so they inhibit epinephrine. But I just want to know, like, do they also inhibit erection and ejaculation, or just the ejaculation, and the person can still have erection?
they inhibit just ejaculation, um, because erection is
Associated with the parasympathetic
yes, erection
mhm,
is actually because of the relaxation of the vessels and
mhm,
the blood flow
flows.
to the cover, uh, so the vessel of the cover, and so um, and that is
Mhm,
why usually erection is inhibited by beta blockers. Uh,
uh-huh.
and it has a central mechanism of action.
And can we give these type of drugs for people with premature ejaculation?
No, because premature ejaculation is uh, because of the uh, central control. So like because usually premature ejaculation is the result of the weak weak sexual constitution.
Mm-hmm.
So and sexual constitution is psychological uh, uh, disease. So like it's not actually a disease; it's like a state, and
Uh-huh.
and people are born with this constitution. It's like uh, the, it's that thing that you cannot change. So and the same is in the women. So
Oh,
and the only way, uh, so it is not possible to change a sexual constitution because it's controlled by the brain. It's very complex.
I
Uh,
see.
but uh, the this disease can be, so like this state can be treated uh, by the training, like mental training, and the mm, the
Control,
control, yes, the
trying.
mind control, like and so like it can be modified a little bit, so and usually it's not a much a problem. And I would recommend for my patients, I would recommend to use a condom, because usually
It
condom,
reduces the sensation.
yes, so sensitivity of the penis, so especially the head of the penis, so and that will actually also will prevent the premature ejaculation as well. So and also even for those with the high constitution, the uh, most for most uh, women require more time for the stimulation, for the sexual stimulation,
Then men.
and to orgasm than men. So that is why anyway you have to stimulate women forehead before a head, like by like uh,
Penetration.
but with other techniques rather than penetration. So so uh, you synchronize with the woman, because all women, regardless of the sexual constitution, will require much more time to be prepared for orgasm. So so that is why uh, this actually there are some drugs uh, for the erection, for the treatment of the erection, like sildenafil, and these uh, but these are used in those patients with the erection, with the absence
Dysfunction
of
with
erection.
ED, erectional dysfunction.
erectile
This.
erectile dysfunction, yes. So
Mhm,
like Viagra is the most popular brand. So
mhm.
the generic name is sildenafil. The mechanism of action is inhibition of phosphodiesterase.
Uh-huh.
So initially these drugs were for the treatment of the heart disease, but
But the side effect, it was discovered by the side effect of these because I guess they noticed when they tried the clinical trials that the people that take these they have more sexual desire, more erection.
no, they didn't discover the side effect at the first place, but the clinical trials were carried out on elderly patients, men, because men usually have more diseases of the heart. So, and then these men uh, uh, asked to give them more of this drug, but they like, and then the midwives were asking why you want it more, and then they told yes, it increases the erection. So
Yeah,
it's like uh, it was not reported as a side effect.
I see.
So they just required this drug to continue to they asked to continue the treatment after the trial was over. So but they hide that during the trials.
Yeah, I've seen something like that, but I was not sure. Yeah, but now it's clear. Yeah.
So okay, so and the these drugs are more selective, though not the sildenafil, I mean the tamsulosin and terazazine, doxazazine, and uh, prazazine. So and but they still have adverse effects, and here actually no, it's not here. So adverse effects are actually the same as for the non-selective. So they also have may lead to the nasal congestion, dizziness, headache, uh, and also orthostatic hypotension. So actually, all these adverse effects are still there, except for the tachycardia. They don't have tachycardia, and also with the sexual dysfunction is less sexual dysfunction.
I want to say something, please, about tachycardia.
Sorry,
I want to say something about tachycardia
what do you mean something?
in tamsulosin drug. We say that it is alpha one blocker.
Alpha 1b subtype.
Alpha one B subtype.
Yeah, so tamsulazine. So tamsulazine here, tamsulazine is used for the treatment of the benign prostatic hyperplasia, uh, BPH. So it's common in old men as well. So and the symptoms are the painful urination because the prostate will increase in the size and make pressure to the urinary tract, uh, and that leads to the painful urination that is actually.
Okay, but anyways, this drug will lead to the decrease of the blood pressure.
No, because tamsulosin is more selective for the alpha 1b subtype that is found in the prostate rather than alpha 1a subtype that is found in the blood pressure in the blood vessels.
That's why we don't have tachycardia in the use of tamsulosin.
No, we don't
That's it.
have tachycardia in the use of any alpha 1 selective like prazosin, doxazazine, and terazazine as well. And we don't have tachycardia because they're alpha 1 selective, so they
But
don't
but
influence
if it
alpha
will
2.
decrease blood pressure, it will automatically cause tachycardia.
They don't decrease blood pressure so much.
Okay.
So because
Okay.
the phentolamine and phenoxybenzamine, they decrease very much, and that is why uh, they lead to the reflex tachycardia, but these are not.
Okay. Thank you.
Uh, so then uh, the Yohimbine. So Yohimbine is also obtained from the plant, and uh, the name is from the Yohimbe, that is a bark, that is a tree, Yohimbe tree, and the Yohimbine was obtained from the bark of this tree, and it has been used also as a sexual stimulant and also for the treatment of erectile dysfunction. So it's a selective alpha 2 blocker. So as you remember, alpha 2 are mostly presynaptic. Uh, but the modern medicine does not recommend uh, the treatment of the erectile dysfunction with the yohimbine. So but it's a traditional medicine, like the bark of the tree has been used for many years in Chinese medicine for the treatment of the erectile dysfunction, rashes, and many other diseases. So it also has a central nervous system action and increases the sympathetic activity, and that is why contraindicated for the patients with the heart disease and also to the uh, patients with the psychiatric diseases. Okay, then we are moving to the beta blockers, and beta blockers are more clinically effective, and they also divided to non-selective, and non-selective is propranolol. Propranolol is the first antagonist, and the Nobel Prize was awarded for the discovery of the propranolol. And there are also selective beta blockers like metoprolol, most commonly used and most effective and useful drug of all this group. I think it's metoprolol because it's beta 1 selective. Uh, Atenolol is also beta 1 selective but less commonly used, and others are also have some beta-1 selectivity, but are less selective, and that is why also used infrequently. And the propranolol decreases the cardiac, so non-selective propranolol decreases the cardiac output and the force of contraction of the heart, and also because of the decrease of the output, it decreases oxygen consumption, and that helps for the treatment of angina, because during the angina, heart consumes too much oxygen, and the lack of oxygen leads uh, to the ischemia. And then the bronchoconstriction can be also treated by the beta-2 blockers. The most commonly used, sorry, so not bronchoconstriction, but like they cause bronchoconstriction in asthmatic patients, uh, and and that is why the non-selective drugs like propranolol are contraindicated for the treatment of the asthmatic patients and patients with chronic obstructive pulmonary disease. Then beta blockers also can decrease gluconeogenesis in the liver, and also decrease the glucagon secretion, and that is why these drugs are contraindicated for diabetic patients, because they will uh, lead to the hypoglycemia and can lead to the coma and death. And so the uh, most useful indication, so these drugs are used as antihypertensive, so most commonly used drugs are metoprolol, but also others like nadolol, esmolol, carvedilol. Some of them are antiarrhythmic, some of them mostly used for as antiarrhythmic, so like, for example, metoprolol and propranolol commonly used as antiarrhythmic drugs. Others used for the treatment of hypertension. Then angina pectoris is treated also. So this is anti-anginal drugs. So that is why angina pectoris can be treated with the propranolol as well. Then myocardial infarction is also treated with the propranolol, and the propranolol is more effective for the myocardial infarction because it's not non-selective, and that in case of the myocardial infarction is better. Then migraine also can be treated with the propranolol, and that is used for the prophylaxis of the migraine, and because so migraine is the headache, repeated headaches that are not cannot be treated with analgesics, and sometimes analgesics increase the episodes of the migraine. That is why propranolol can be used for the prophylaxis. And then also hypothyroidism can be prevented by the propranolol, because uh, the epinephrine is released during the in the patients with the high thyroid hormones. So both of these drugs are administered orally, and they are absorbed well, and across blood-brain barrier, and then excreted by the urine. Adverse effects include bronchoconstriction, fatigue, sexual dysfunction both in men and women, and arrhythmias after the abrupt withdrawal. So that is why one should decrease the dose gradually before discontinuation of the drug. So and the mechanism of sexual dysfunction is not yet understood, because ejaculation in males, for example, mostly done through the alpha adrenergic receptors, uh, and this, like, beta blockers are not present in the vessels. But still, maybe it is because of the central action on the beta receptors. And central nervous system adverse effects also include the dizziness, depression. Weakness is also central because of the central nervous system action. So sympathetic nervous system is decreased, the deactivated. That is the reason of the fatigue. Hallucinations, short-term memory loss, vivid dreams during the sleep, and depression are reported by the patients. Then some of the drugs, like, for example, timolol and timolol is used for the treatment of glaucoma, as the eye drops, and same for the carteolol and betaxolol. So these drugs are prescribed as solutions for the as eye drops, and they decrease the secretion of aqueous humor in the eye, and they, unlike the cholinomimetics that can also be used for the treatment of glaucoma, they don't affect the vision, and so less adverse effects, and they last long. Like, they after the administration, they can last up to 1 day. So require only 1 day administration, and usually are used for the chronic management of glaucoma. So then selective antagonists, like metoprolol, esmolol, nebivolol, atenolol, are mostly used for the patients with asthma and diabetes. So that is to prevent the side effects, and they are more selective, less side effects, especially so in this group of patients. Then labetalol and carvedilol, these drugs are blocking both alpha and beta receptors, and so they are beta blockers, but also block alpha 1 subtype of receptor, and that leads to the dilation of the vessels and a reduction in the blood pressure. So that is why they are useful in the treatment of the hypertension. Then, and the last group is neurotransmitter or uptake and release affecting drugs. This is reserpine. Reserpine was initially are uh, obtained from the Rauwolfia serpentina, that is a plant, and reserpine is an alkaloid of the plant, and it has been used for a long time in a traditional medicine for the treatment of depression, and in traditional Indian medicine, yeah, and the Gandhi was using that for the treatment as a tranquilizer, and uh, the the drug was uh, was identified uh, in the previous century, in the middle of the previous century, and then it was marketed as an antihypertensive drug. And the antidepressive action was also uh, confirmed in clinical trials, but it is less effective as a modern antidepressant drugs. But still, it's has a proven efficacy, and the extract can be used for the treatment of uh, anxiety, depression, and also is effective as an oral antihypertensive drug. But the only thing that is it has a slow onset of action, and is also toxic, and it accumulates like after discontinuation. The effect of reserpine will last for several weeks, and in case of the overdose, the treatment can be a problem, uh, because it is non-selective. So that is all for today, and actually, if you have any questions or comments, then feel free to ask them in comments. Thank you very much for attention, and see you next week.